Vanakkam everyone, this is Dr. Priyadashni. I welcome you all to another Fatafat lecture. Today we are going to learn lines or planes in cephalometry. These lines or planes are obtained by joining two landmarks and they are classified into six horizontal planes and 4 vertical planes. So let us get started. First of all, horizontal planes. For horizontal planes we are going to remember like this. See, like this. So we have learned this in a first year anatomy for the facial nerve branches. Do you remember? So like that we are going to learn for horizontal planes, lines or planes. Okay. So first of all is the Cephalometrics plane. So few planes are self-explanatory. By the name itself we can identify like that. So it is Cephalometrics plane joining the cella and the nasion. And second is the Frankfurt's plane. Frankfurt's horizontal plane is the plane joining the porion and the orbital. Third is the palatal plane. Palatal plane is joining the ANS and the PNS. Fourth one is the occlusal plane. Occlusal plane is the line drawn alongside of the occlusion of the patient. Fifth one is the mandibular plane. Apart from other planes, mandibular plane differ based on the analysis. So for example, Tweed's, Steenus and Downs analysis. For Tweed's analysis, it is the tangent drawn to the base of the mandible. And for Steenus, it is the line joining the gonion and the gnathion. And for Downs, it is the line joining the gonion and the menton. So for Downs, you can remember like the most down, the lowest point is the menton. No? So like that you can remember. So line joining the gonion and the menton is for the Downs analysis. So and last one is the basion and nasion. Okay. So basion nasion plane. Okay. So let us recap horizontal planes. First one is the Cephalometrics plane. Second one is the Frankfurt's horizontal plane. Third one is the palatal. Fourth one is the occlusion. And fifth one is the mandibular plane. Last one is the basion nasion plane. Okay. So let us go to the vertical plane. Vertical plane are aesthetic plane, facial axis and apogonion plane. Aesthetic plane alone drawn based on with the reference of soft tissue landmarks. Okay. So those are the anterior most point on the soft tissue of the nose and the anterior most point on the chin of the soft tissue of the chin. Okay. The line joining these 2 points form the aesthetic plane. Next one is the facial plane. For facial plane, it is the line joining the nasion and the pogonion. So third one is the facial axis. Facial axis is the line joining the PTM point, that is the pterygomaxillary point, and the gnathion. Okay, gnathion here. So last one is the apogonion plane. Apogonion is the line joining the point A and the pogonion point. Okay. So these are for the vertical planes. So let us recap for vertical planes: aesthetic plane, facial axis and apogonion plane. So these are all about lines or planes in cephalometrics. Thank you.